Welcome to this on-demand video, which will address commitment as one of the 4 outpatient core elements as defined by the Center for Disease Control and Prevention, also known as the CDC. The primary goal of this project is to increase the number of outpatient settings that have incorporated all 4 elements of outpatient antibiotic stewardship, and we'll be releasing a video each month until all elements have been discussed. The core elements themselves, as well as tools and strategies for implementing or enhancing them, will be the focus of this presentation. Specifically, we're asking that emergency departments, emergency services, urgent care centers, physician offices and clinics, and community pharmacies to view and implement at least one strategy to increase your organization's commitment to antibiotic stewardship. My name is Deanne Richards, and I'm an infection preventionist project specialist with the Lake Superior Quality Innovation Network that serves Michigan, Minnesota, and Wisconsin under the Centers for Medicare and Medicaid Services Quality Improvement Organization program. The core elements of outpatient antibiotic stewardship provides a framework for antibiotic stewardship for outpatient clinicians and facilities that routinely provide antibiotic treatment, and were developed through a combination of consolidating evidence-based antibiotic stewardship practices and building on or adapting known best practices for antibiotic stewardships across other clinical settings. Today's topic is commitment. How does an organization show commitment to antibiotic stewardship? I would make the following suggestions. Use posters in your examination rooms or displays in similar messages across waiting room TVs that show patients and family members your organization's support of antibiotic stewardship efforts. Not only does this provide patient education, but it also supports your prescribers or providers when explaining why antibiotics may not be the best choice for treating their symptoms. A study with the only intervention of placing posters with the clinician stating they were committed to prescribing antibiotics appropriately resulted in a 20% reduction of antibiotic orders that were considered to be inappropriate. Also, identify a single leader to direct antibiotic stewardship activities within your organization. This could be a physician, a member of your C-suite, or an individual who reports to leadership. This individual needs to be accountable for the outcomes of your program. If your organization has already completed a signed participation agreement to have support provided by LSQIN or your local quality improvement organization, congratulations, you have already identified a single leader. Including antibiotic stewardship related duties in job positions or in job evaluation criteria is another means to show commitment. Communication with all staff to set patient outcomes. What does that mean to us? Well, all staff members need to understand that all patient visits for acute illness might or might not result in an antibiotic prescription. Administrative staff members, medical assistants, technicians, nurses, and allied health professionals and medical directors can improve antibiotic prescribing by using consistent messages when communicating with patients or family members about indications for antibiotics, using such words as, "Our goal is to provide you with the best quality of care to help you heal as soon as possible. Sometimes this includes antibiotics, but not always." Or, "Tell me more about your symptoms so that we can be sure to make you more comfortable." Another option may be, your provider will develop a plan with you for relief of your symptoms and help you feel better. Another option may be, your treatment will be based upon the assessment, but will also include you in taking steps to make sure that you are more comfortable. During staff meetings, review any of the above options or develop your own statement that members will use when patients or family members immediately ask for antibiotics. Once you have one of the previously 4 explained elements in place, being posters of support, single leaders, job descriptions, or all staff giving a consistent message, we wanted to provide some additional ideas that may help support your commitment. Policies, formal board, or leadership approved statements can outline the commitment to only using antibiotics when necessary and selecting from the frontline agents whenever possible. Incorporating antibiotic stewardship into your quality programs can increase staff productivity and improve patient outcomes, such as in sepsis response or community-acquired pneumonia. Ensuring that information on activities and outcomes regarding antibiotic stewardship is shared with leadership provides a report structure and keeps stewardship in the forefront for leaders. Allowing staff to take advantage and paying for their time spent receiving education is another method of showing commitment to antibiotic stewardship. Even these short, on-demand videos can be a way for staff to receive education on this topic. If you are funding remote infectious disease physicians or pharmacists, this is also a means of showing commitment to antibiotic stewardship. And finally, including antibiotic stewardship requirements in contractual requirements and responsibilities is a great way to demonstrate commitment. Although the core elements provide a framework for outpatient antibiotic stewardship, implementing the elements requires a thoughtful and consistent effort to achieve desired outcomes. This includes developing strategies and preparing individuals, facilities, or organizations for change, developing and testing stewardship interventions, identifying and addressing barriers to change, and evaluating progress towards stated goals. Outpatient settings remain a crucial component of antibiotic stewardship in the United States. Establishing effective antibiotic stewardship interventions can protect patients and optimize clinical outcomes in outpatient healthcare settings. LSQIN participants are encouraged to refer to the toolkit, which includes additional information on commitment. Individuals outside of Michigan, Minnesota, or Wisconsin are encouraged to contact your own local quality improvement organizations for similar resources. Thank you for joining me today to discuss commitment for the outpatient settings related to antibiotic stewardship.